pass it once done.
Becky, you'll have to say
Can you
your
give me
title.
1 second, Dr. Wiegman? Naturally, your guys' list prepared.
Are you guys speaking together?
I'll be speaking. I will refer to Becky just for one piece.
I'll have to give you her title.
Yeah, we're just trying to keep our distance.
Maintain social spacing.
Social distancing. Got to model good behavior. You guys are probably a little close.
You guys ready?
Okay.
Do you want to start with say and spell your name for them and your title?
Sure. My name's Dr. Bridget Wiefling, W-I-E, F as in Frank, L-I-N-G. I am the Senior Vice President for Primary Care and Ambulatory Specialty at Rochester Regional Health.
My name is Rebecca Alley, R-E-B-E-C-C-A, last name Alley, A-L-L-E-Y. I am the Vice President and Chief Nursing Officer for Ambulatory Services at Rochester Regional Health.
Just one moment. I'm just going to check an audio problem here.
Okay.
Yes. So what can you tell us about the testing so far?
Yes. So thank you, and thank you for giving us an opportunity to talk about our testing process and some of the exciting stuff we're trying to do in order to meet the public demand and help our community to control this epidemic. We currently are asking all patients that if you believe that you have symptoms such as respiratory illness, such as cough, fever, shortness of breath, in conjunction with sometimes we are seeing some GI symptoms and palpitations. We're asking that you call your primary care provider and talk with your primary care provider. They will help you to be triaged to the appropriate setting for evaluation. Much of the evaluations can actually much of the evaluation can be done over telehealth or telephonically. We are not currently recommending that every single patient with respiratory symptoms be tested for COVID. We are recommending that patients call their primary care provider for appropriate triage. We are asking the primary care providers then to refer patients that they do believe need testing to our urgent care sites for COVID testing or other evaluation, a higher level of evaluation. We set up a tent at Wilson outside so that we could ensure the safety of the patients and our providers who are our frontline healthcare workers, trying to ensure that all patients are receiving the care that they need. Any further evaluation that needs to be done is being appropriately triaged. It's a pretty efficient way of delivering care, a little bit unique, obviously, but these times are really requiring innovation. And so patients who are referred to Wilson would be driving up in their car. They're being triaged in their car, and they stay in their car and they go in for, they're registered, and then they're seen by a provider, and determinations about what kind of treatment they need or what further evaluation they need is made at that time. And we also have several other sites that our primary care providers will be referring patients to for screening of their upper respiratory symptoms, and that is the immediate care in Webster, the immediate care in Henrietta, our immediate care in Greece, as well as in Batavia, United Memorial Urgent Care. And we're very pleased with the processes that those sites have put in place, again, to protect the patients and the staff and to ensure that people are receiving quality care.
So patients who are being referred to this testing, the driver testing, how severe are their symptoms, or how are you kind of deciding who should
So this is really the importance of using your primary care provider. And if you don't have a primary care provider, then we are using a link line called 922-CARE. And I'm going to let Rebecca Alley, our leader for nursing, our vice president, talk about 922-CARE.
Hi, good afternoon. So it is extraordinarily important during this time that we make sure that we are meeting the needs of the patients, getting them to the right level of care at the right place at the right time. We don't want to overexpose patients that are well to illness, and we don't want to expose healthcare workers to ill patients unnecessarily. And so the ask from us right now is if you are sick, if you're experiencing symptoms, please call your primary care provider. If you don't have a primary care provider and you are sick and needing help with symptoms of COVID, please call 922-CARE. That line will ensure that you have the information that you need and, if necessary, direct access to an RN who will be able to assess your symptoms and ensure linkage to the appropriate level of care, whether that be home management with telemed or telephonic visit, whether that be linkage to an office if it's not a symptom of COVID, or whether that's an urgent care center if you need a higher level of care, or for emergencies, obviously linkages to our ED. It will provide the most safe and effective triage to get you as the patient to the right place at the right time so that we can meet your needs and make sure that you have the testing that you need to keep you as healthy and well during this confusing time.
Again, I think, the most important thing for everyone to remember is that 80% of the patients who are infected with the coronavirus are actually doing quite well. And so that's a good thing. And it is very important, the relationship that you have with your primary care office, because they know you. And so that is why we are using our primary care providers as really our guide to understand how best do we treat each and every patient, because every patient's different and very individual.
How does the test happen? What do you do?
Yeah, so the test is actually very simple. It's very, very similar to the flu swab that many of us have probably had over the years. It is a nasal pharyngeal swab, and it's just a very quick in and out of the nose and into a viral medium procedure. Doesn't hurt. It's a little uncomfortable, but it doesn't hurt.
And where does it go from there?
So then it's sent to the lab where it's appropriately, it's going to be sent to the Rochester General Hospital lab, because as you know, Rochester General Hospital has been able to develop the COVID test, and so we're very excited about that because it has increased the capacity from approximately the ability of our area to do 21 screens a day to now we're able to do over 100 screens a day just at Rochester General. So we're very excited about that. We know that the university is also working on that, and we've had a very collaborative relationship.
How many tests have you done so far?
I have lost track, but I know it's well over 200.
Is there any concern running out of tests in the coming days?
Yeah, so that's why it's really important that we are cautious about who we're testing. We're obviously not able to, because of resources and testing availability, we're not able to test everybody that would like to be tested for COVID. We really need to have the providers, both the primary care providers and our urgent care and emergency room teams, make decisions about who are the patients most likely to have COVID and benefit from testing. And so that's where a lot of the focus is at.
What is I've spoken to somebody who was tested, and it took about 5 or 6 days to get those results. Mm-hmm. They were frustrated with how long it took.
Yes.
What is
so, yeah. So what we're currently working through is the turnaround time can be anywhere from 2 days to 5 days, depending on where the specimen is coming from and going to. And so it is not a super fast test. It is much faster in the acute care setting. However, what is really important for everyone to understand is that even if you're going to get tested, if you have, at this current moment in climate, if you have a respiratory illness, if you have fever, cough, shortness of breath, you need to self-isolate immediately. You need to make sure that you are contacting your provider office before you go in for any provider visit. You need to ensure that you are keeping your household members as safe as possible by using good hand hygiene, covering your cough. If you are self-isolating, staying in your room, and it means you're not going to Starbucks for a latte, okay? It means that you really need to stay put in your room, in your home, to limit the exposure to your friends, your family, and anyone else in the community. It's also really important that patients who have symptoms, if you are presenting to a healthcare facility, you need to make sure that you are immediately notifying the team at the front that you have symptoms so that they can give you a mask to put on. That will keep everyone that's in the healthcare setting safe, and then that will also help to prevent spread.
We have people in our community who have children in their home, or even their in-laws or parents in their home who are immunocompromised. I don't know if I'm using the correct word, immunocompromised. They're concerned about quarantining in their own home. What advice can you give them?
Yeah. Again, the best thing that you can do if you have no other option is to self-quarantine in your home, stay in your room to the best of your ability, try to make sure that you're wiping down shared spaces after you've been in them, making sure that you're using great hand hygiene, both as the potential patient that has an infection as well as the family. You want to make sure that you are watching for symptoms in asymptomatic cohabitants in the house, because that is something people are, we're going to want to know about if that's happening. And really right now, there is no treatment for the coronavirus. It is supportive therapy, and so it's about, over-the-counter non-steroidal anti-inflammatories. It's about fluids. It's about rest. It's about, keeping warm.
So even if somebody thinks they have just a cold, do you recommend people not just treat it as just a cold?
So we are recommending quite a conservative approach to how you think about your illnesses, and that's why it's really important that you call your primary care provider if you think you have a cold, so you can talk about it, and so that the provider can ask you more specific questions that might help us to understand that it's just a cold. However, even if it's just a cold, because this is an imprecise clinical assessment, we really are asking people to stay out of the public, and again, to use really good hygiene.
So you said the number of tests that you're able to do at RGH has grown. So do you expect that to continue growing? Like, what's the process like with growing that testing?
Yeah, I think we're optimistic that we'll be able to grow our testing, and so I think Dr. Reedy would be the person who I would most want to pull on for that.
So how many drive-through test sites do you have right now? What do you expect to have?
Yep. So, well, we will be assessing how well this particular process goes. If it goes well, we will expand to our other sites.
So you have 4?
We currently have, I have to count in my head, I think it's 6 sites altogether that you can be referred to by your primary care provider.
What's been the biggest challenge with testing so far?
The biggest challenge with testing so far is a lot of the fear that people have about wanting to be tested even when they're not symptomatic. We're also seeing a lot of issues with patients who are being told by their employer that they have to be tested for COVID before they can return to work, and that really is not appropriate and not a good use of our minimum of our testing ability.
So say a person has been near somebody who tested positive, should they not try to get in right for a test if they're not showing symptoms? Should they wait and see and self-isolate, I guess?
Again, I'm going to say it's really important that if you have these kinds of questions, that you can do one of 2 things. You can start with the 922 info line, which has a lot of information about COVID and can help give you some guidance. It is important that you call your primary care provider so that they can help you to assess your own situation, your own risk, your own symptoms. We also don't want to miss something more serious. We don't want to miss a bacterial infection that can be treated. We don't want to miss a heart attack or a pulmonary embolus. So it's very, very important that all things that cause fever or cough are not necessarily COVID, and that is a challenge for the medical community right now. We also have, as I said, as Becky talked about, we've got the 922 care line. If you do not have a primary care provider and you believe that you have COVID-type respiratory symptoms.
I do want to clarify one statement because I wasn't sure exactly on the question. We currently have 1 drive-through testing locations with additional 5 referral sites that can do testing to that drive-up. But the other 5 sites are not currently set up as drive-up, as Dr. Weefling said earlier.
Yeah, I mean, we're trying to determine, we want to make sure that this works before we expand it. If it works, then we will expand it.
How do you know if you go to the drive-thru or you go to here, for instance? Who determines that?
Again, if you're working with your primary care provider or you're calling the 922 care line, they can help you to know where's the best site for you to go.
Yeah, it's just that I would highly encourage the use of the primary care provider to ensure, again, your safety. We want to make sure that the folks who are going to these sites are not exposing themselves to something unnecessarily either. So please call your primary care provider so that you can be safe and we can be safe. If you don't have one and are sick, please call 922 CARE.
And the other thing is that, you know, we are doing the virtual visits and we are doing telephonic visits. So there are other ways that we can assess you, help you get the treatment that you need, give you guidance on the medications that you may need to take. So it's a really good opportunity to build that relationship.
So you said one of them is drive up, and then the other 5, are they still being tested outside then, or are they're able to go in at those other 5?
We're currently using standard protocol for how to manage patients that are at risk with respiratory symptoms and potential COVID.
Can you list the top 5 of the most important symptoms that people should look out for you?
So we're seeing fever is sort of the number one thing that we're looking at. So it's fever, cough, shortness of breath. Some of our patients are presenting with some GI symptoms, and some of them are also presenting with some cardiac type symptoms associated. We also are, starting to get a little bit of a sense of what's happening with their blood counts and chemistries, and so we don't have enough data yet to truly comment on that, but for the general public, it's really about fever, cough, shortness of breath, and if any of that is associated with some GI symptoms, that's not necessarily atypical, and it also may be associated with some cardiac symptoms.
This is allergy.
It is allergy season, just to make it all worse. Yeah, and so, I've even been talking to my own family members to try to help reassure them that allergies do exist and that they are different, and the symptoms that you have from allergy are, slightly different, obviously, than our COVID symptoms. However, it's very difficult to tell, and it really requires a lot of discussion to get to the bottom of how do we create the right differential diagnosis so that we are not missing something in a patient and that we're doing everything that we can to ensure that we're keeping that patient and other patients in the community safe and keeping our healthcare workers healthy so that they can continue to treat patients during this epidemic.
What about anything for our nurses and doctors that are working nonstop? Do you have any message for them?
Yeah, I just want to say, God bless our healthcare workers who are on the front line, and God bless our first responders. They are amazing individuals. I have never in my life had the privilege of working with such incredible people here in Rochester at Rochester Regional Health. I am awed and humbled every single day by the way that our providers, our nurses, our access associates, even our administrators are going above and beyond. They're putting themselves, their well-being on the line to ensure that our communities stay safe, that our patients get the care that they would want for themselves or for their family. The way that our team has pulled together to get us ready as a health system for this epidemic has been an unbelievable feat, and a lot of incredible people working very hard day and night, 24 hours a day. Our task force is running, and we've been able to really mobilize resources quickly and effectively and efficiently, and we will continue that process because it is important that we are doing everything we can to protect this community, and we intend to live up to our promise to the community of upstate New York. Thank you.
Thank you, guys.
Good.
Very good.
Back to work.